And hello, everyone. Welcome back to class. So it's week 2 now, and the topic for this week is creating a PICO. So, as a physician assistant, you're going to have questions. What do I do when a patient presents this way? Or what is the best way to treat X, Y, and Z? Or you might just want to know more information about something. Now, I think in the initial portion of your curriculum, you discuss the PICO, but it's important for us to come back to it because this is going to set the foundation for what you do the rest of the term. This is going to help you come up with your topic for your dissertation. So the PICO stands for population, intervention, comparator, I've seen control or comparison, and then outcome. I've also seen people describe the PICO as PICO TT. So again, patient or problem. What are the important characteristics of the patient that you are working with? What is that condition or disease of interest? The I again being that intervention, the exposure of interest or the prognostic factor, C being the comparison, O being the outcome, and then we're not worried about the two T's, but I just want to illustrate or highlight this because occasionally you will see people include the two T's, and the two T's relate to the type of clinical question and the type of study design to answer the question. Now, probably 95 to 99% of the time, you're going to see people talk about the traditional PICO. And within the traditional PICO, the clinical question that you come up with is really going to direct the type of study of interest. The purpose of the two T's are just for bookkeeping. Now, as you've learned, there is a variety of different study types, a hierarchy of evidence to help us answer clinical questions. And depending upon the type of question that you have, there is a preferred type of study. Now, last year, I would say the majority of students in the Doctor of Medical Science program looked at therapy-related questions. And so with a therapy-related question, ideally, you are looking at a double-blind randomized controlled trial or exploring systematic reviews with meta-analyses. There may not always be double-blinded randomized controlled trials, and so you need to then utilize the next highest level of evidence. Ultimately, the types of evidence that you use may depend upon whether you do a systematic review for your dissertation or a scoping review. With a systematic review, ideally you would focus on randomized controlled trials. With a scoping review, that usually means it's a relatively new topic. There may not be a lot of there might not be a lot of randomized control trials. And so you may need to go to evidence that's lower on the hierarchy. Here's just another table presenting the PICO per the different purposes or functions that we serve in healthcare. Therapy, diagnosis, prognosis, patients are interested in that a lot of times. And then, of course, sometimes you may be interested in risk or harm. For example, maybe from a negative outcomes perspective, what's the harm that could be done to a patient if they utilize a certain medication with a different comorbidity. Now, this slide here, this obviously is very small. If you want to explore it at all, this is the Oxford Center for Evidence-Based Medicine Levels of Evidence, and there's a link there that would take you to the web page. Now, why am I presenting this here? This is illustrating the top study designs, their recommendations based upon if you are doing a review of diagnostic studies, of studies related to prognosis, studies related to treatment or therapy, and studies related to harm associated with a treatment. This informs potentially our thinking about the types of studies that we would want to include. And again, if you're doing a systematic review, preferably you are just focusing on randomized controlled trials. If there's not a preponderance of evidence from randomized controlled trials, then you would do the scoping review. Sometimes some journals will ask authors to present the level of evidence and the study design. So here's a review article that I did with a friend, Eric Medra, and this was published in Sports Health. Sports Health is a journal that is for orthopedic medical providers, like orthopedic surgeons, PAs who do orthopedic work, certified athletic trainers, and physical therapists who do sports rehabilitation. And so where the arrows are illustrated there, this was part of what they desired, was the study design and the level of evidence. And so you can see there where we highlighted case report and then randomized controlled trials and gave scores of either a 2 or a 5. Visually, you've probably seen this pyramid, this hierarchy of evidence. And at the top is a systematic review with meta-analysis. So at the very top there, it just says meta-analysis. A meta-analysis is the statistical process of looking at all the data related to systematic reviews. You can do a systematic review without a meta-analysis. When we get to that, I think it's in the second term, we can discuss that. That may be something of interest to you if you have, if you were going to do a systematic review and you've got the data available, we could potentially consider that. Those who did systematic reviews last term, I think one person did a meta-analysis and the rest did the systematic review without the meta-analysis. Then, of course, there we can see the sliding down the pyramid, the randomized controlled trials, cohort studies, case control studies, case series and case reports, and then animal studies and laboratory studies. And in some pyramids, at the bottom might be expert opinion. And this particular one illustrates that you'll see different types of pyramids. They're essentially the same. the authors might depict things in a different fashion. So, how about let's take a look at using the PICO to guide clinical practice. So, looking at the 5 A's of the evidence cycle: assess, ask, acquire, appraise, and apply. First, with assessing. As a physician assistant, you perform clinical evaluations. So, representing that is the first A in this evidence cycle: assess. The method of evidence-based clinical practice begins with the thoughtful assessment by a clinician who incorporates all the pertinent data. Next, ask. This is the clinical question development. The first critical step is to clarify one or two key issues that come up in the course of caring for your patient and to develop a focused clinical question. So, for example, as a physical therapist, I might want to know what the best PT treatment is for patients with subacute low back pain. That might be a common population of people that I would work with in an outpatient orthopedic physical therapy practice. This is where the PICO comes into play. And so my overall question, what's the best PT treatment for patients with subacute low back pain? Now I'm going to try to really specify things. Let's say I'm interested in a younger adult versus an older adult. So for a 30-year-old patient with a subacute low back pain, let's say 16 days or less, what is the best physical therapy treatment for reducing pain? I could further define it, stating no radicular pain beyond the knee and a negative neuro screen. Now, knowing different treatments, what I might do is speculate that spinal manipulation could be a good treatment, and I might want to compare that against something like range of motion exercises. Sometimes you'll see things as standard practice or usual practice, or maybe another known treatment. And I'm curious in pain, so I might want to, as the outcome, find something that reports pain on a 0 to 10 scale on the 0 to 10 visual analog scale. So now I need to go about acquiring that potential literature. So armed with your PICO question, attention now turns to finding the evidence in the medical literature. Now, next week, we're going to explore how to search the literature. And then in subsequent weeks, we're going to review study designs and the pros and cons of each. Next, A is appraise. And this is the point where, as you've collected your literature, you're going to critically appraise it. Now, as I share examples throughout the term, most of the time that appraisal is qualitative in nature, meaning that the students in the past in this program have discussed the strengths and weaknesses of particular studies. There are potentially quantitative ways of appraising the quality of a study. Some of these you may find in articles. If you find a systematic review or a literature review of some type, you might find these. How valuable they are is questionable. And the reason I bring that up is sometimes you can have a randomized control trial that, by its definition, illustrates something of value, but it may not completely capture all facets of the care of that patient and the condition. So what do I mean by that? Well, An example is with adhesive capsulitis. There was a paper that won an award. It was a randomized controlled trial where they looked at two different strategies to perform a manual therapy technique to the shoulder to try to improve range of motion. And it was done for a short period of time with a relatively small sample population. And so you might know that adhesive capsulitis patients may suffer from that condition for a year or two before they get resolution of symptoms and get range of motion restored. So, on one hand, a randomized control trial could tell you something about a certain treatment and how it affects improvements in shoulder range of motion in that population for a 6-week or 8-week time period. But how did it affect the patient long term? On the other hand, you could take a quasi-experimental study, and this is one that we will take a look at later in the term. And in that study, they compared people who received a manual therapy technique, so more of an aggressive physical therapy approach, versus those who were told just to stretch as tolerated. And they monitored people over the course of, I believe it was 2 years. It was a quasi-experimental study in that there was no randomization. And there was an outcome that favored those who did more of a kind of self-controlled approach. But as a quasi-experimental study, it would score lower on some of these particular tools. Now here the QUADIS, this is for diagnostic accuracy studies. It has criteria. If you wanted to look it up, you could. You don't have to. Nobody used these things for any of their particular scoping reviews or systematic reviews. Here's the modified, I believe it's pronounced that JADAD, scoring a study for looking at its, I guess, quantitative. It's a quantitative measure of the quality of it, where it would fit on the hierarchy, not on the hierarchy, excuse me, of its basically looking at what are the threats to its validity. You might see things like this, the SORT statements, the strength of recommendation taxonomy. Sports health, again, asks for these. These are qualitative statements that are provided with a semi-quantitative measure. And so in this particular one, this was another review that I did with Eric Medra. And in this particular paper, we were looking at hip strength and patellofemoral pain. And so we provided a clinical recommendation and then provided A, B, or C score based upon the level of evidence that was available to support that clinical recommendation. You might see this in some journals. This is not something that we are going to ask you to do. I just wanted to make you familiar with it. If you were to submit to a journal such as Sports Health and you did a systematic review or scoping review, this would be something potentially that would be required. Finally, applying the evidence to the patient. So after you've gone through that process of wanting to know more about the patient population, having that clinical question, doing your search of the literature, appraising the literature to see if that study or studies, if that can move the needle, if that can change your practice, then you look to apply that evidence to your patient population. Okay, so this week, your assignment is to create a PICO. Now, I think some of you may have done this already, and so if you want to use something that you've used in the past, that's perfectly fine. You may even want to use that to start as the foundation for your dissertation. That's great. Or if you want to do something completely different, that's fine too. Now this says in the discussion link. I don't think I have a discussion link, but what I've got is a discussion uh, thread set up in Canvas. So it's not really a link. You'll see there's that discussion topic where you'll put your PICO. And then that way I can see it and then others can see it too. We can kind of learn from each other and see the depth of things that people are going into. For this discussion, though, you are not required to respond to your classmates' posts. I'll be responding, but others, you don't need to do that. And this PICO does not need to be the same PICO that you will use for your major assignment 1. So this week, you'll see that major assignment 1, the instructions for it are online. And I'm going to pull those up now. Give me a moment here. Okay, so major assignment 1 is available for you to review. And this is going to be due, this assignment due by the end of week 10. And so I'll have you read through this here. Easier to read through it kind of on your own. The scoring rubric is going to be down here at the bottom, the things that we are looking for. So what is it you are doing? You are going to be creating a focused clinical question, utilizing search strategies to identify the best available peer-reviewed sources. Now, you'll find some examples in this week. And so here is a PICO format to analyze reduced psychotic symptoms with ketogenic diet in young adults with schizophrenia. And so what you'll see then is there's going to be an introduction that is created by the author, you in this case. And it's not going to be a long introduction. You're going to define your PICO question, present your focused clinical question, and then provide a summary of your search terms, results from your search, and then a discussion around the available evidence. And this does not have to be a sizable amount at this time. Let's keep it to 5 studies. And what this assignment starts to do is it allows you to, again, practice the creation of a PICO based upon a clinical question, searching the literature for evidence, and to start to create kind of an expression or sharing or dissemination of the key findings from those studies. It also helps you to determine if this is the path that you want to go down. Last year, I worked with a couple students, and they had ideas that were meaningful to them at the start of this sequence, but come class 2, ARP2, they had to make changes because as they explored the literature more and more, there just wasn't enough research out there to create a meaningful dissertation. All right, and so here's how you'd lay things out in your discussion thread. PICO, adult male or female with a history of ischemic heart disease, intervention Mediterranean diet, comparison, the standard American diet, and outcomes, cholesterol levels, and blood pressure. This is very basic. I may want to um, increase some things, like I may be interested in adults with ischemic heart disease that are 50 years of age and older. And I may want for my outcomes to have some time component. What are cholesterol levels? What are blood pressure levels at after 3 months? All right. If you have any questions, please reach out to me. One final teaser. This is what you're going to be attempting to do. Well, not attempting, you will be doing. You'll be creating a systematic review or a scoping review. And at the end of the year, you're going to present your findings on a poster as part of the symposium. And as I mentioned before, or if I didn't mention it last week, I'll mention it now for the first time. My hope is that as you work with the PA faculty or whomever you include as part of your dissertation committee, that with all the hard work that you put in, you try to disseminate those findings to a larger audience. Meaning trying to publish. We're currently trying to get the first paper published. That's been submitted, and hopefully in the next week or two, we'll find out results from that. And working on another manuscript right now from somebody in the graduating cohort. So it's really kind of an exciting time. And the things that I hear from students that maybe like, boy, this feels like overwhelming. Well, one, let me help you in that process. And two, sometimes people feel like, gosh, you know what? No one's going to be interested in this. Well, I've said this to many people. If it was interesting to you, I guarantee you that it's interesting to others because you're not an N of one. All right. Have a great week. Talk to you soon.